All right, sir, we have the results back from your MRI scan, and I'm afraid it shows a malignancy in your lungs. Do you see this patch right here? This is called a malignant tumor. Mr. Haziq, I really hate to be the person to tell you this, but you have lung cancer.
Your friend? Hey, how have you been?
I'm doing great. What about you? How's life treating you?
Not bad. Work's keeping me busy. Same old stuff, really.
Oh, I see. Wait, is that Haziq? Are you smoking now?
Yeah, just picked it up a couple years ago. It helps with the stress, you know?
Come on, Haziq. You know that stuff is bad for you. You used to hate smoking. What happened?
Life, I guess. It's just a little something to take the edge off. Don't worry, I'll get it under control.
There's no under control of this. It's a slippery slope. Come on, Haziq. You're better than this.
I get it, but it's my choice. Let's not make a big deal out of it.
Fine. I'm only saying this because I care. But just promise me that you'll at least think about quitting, okay?
I will.
Cancer is a disease in which abnormal cells grow uncontrollably and spread to other parts of the body. Normally, cells in the body grow and divide and die in a controlled way. However, when this process goes wrong, damaged or abnormal cells continue to grow and divide when they shouldn't, forming a mass called a tumor. So there are two types of tumors. One, benign tumor. These are harmless, non-cancerous. Two, malignant tumors. These are cancerous and they can spread to your tissues and other organs. Cancer can develop in almost any part of the body and has different types such as lung cancer, breast cancer, leukemia, and also skin cancer. The causes can also vary, but it mostly includes genetic mutation, lifestyle factors, and also harmful substances such as tobacco smoke and radiation.
So, what is lung cancer? Lung cancer is a type of cancer that begins in your lungs when the abnormal cells divide uncontrollably and it forms a tumor. Over time, this could affect respiratory function and it could spread to other parts of your body through your bloodstream or your lymphatic system. Now, there are two main types of lung cancer. One, non-small cell lung cancer, NSCLC. Two, small cell lung cancer, or SCLC. NSCLC is the most common type of lung cancer, accounting for about 85% of the cases, and can be further divided into three subunits. 1. Adenocarcinoma, 2. Squamous cell carcinoma, and 3. Large cell carcinoma. On the other hand, SCLC is the least common but more aggressive type of lung cancer because it spreads quickly.
So, how does one develop lung cancer? Is it purely caused by smoking? Well, there's actually many factors that may affect lung cancer risk, ranging from the ones you can change and the ones you can't. We'll take a look at the ones you can change first, and one of them is smoking. Smoking is by far the leading risk factors for lung cancer. Did you know that people who smoke cigarettes are 15 to 30 times more likely to get lung cancer than people who don't? Well, that being said, smoking is super addictive thanks to the nicotine present in the cigarette, which makes it a lethal combo. Nicotine can reach the brain fairly quick, and this creates a dependency, which eventually makes the smoker become addicted. Now, here's the thing. Even if you don't smoke, breathing in the smoke of others can also increase your risk of developing lung cancer. This is called passive smoking or secondhand smoke. It isn't just unpleasant for people, it can also damage your health too. People who breathe in secondhand smoke regularly are more likely to get the same diseases as smokers, which includes lung cancer and also heart disease. Next, exposure to other cancer-causing agents, aka carcinogens, in the workplace can also increase lung cancer risk. Now, this includes radioactive ores such as uranium, inhaled chemicals such as arsenic, beryllium, cadmium, and silica, and lastly, diesel exhaust from vehicles. Now, although the government and industry have taken steps in recent years to help protect workers from many of these exposures, but the dangers are still there. So if you work around these agents, you should be careful to limit your exposure whenever possible. Now, another factor worth mentioning is the use of e-cigarettes. E-cigarettes are a type of electronic nicotine delivery system, and one good example of this is the vape that youngsters use nowadays. Now, most e-cigarettes contain nicotine, so the Food and Drug Administration (FDA) classifies them as tobacco products. The FDA states that e-cigarettes cause health risks. Now, this also includes lung damage, and furthermore, e-cigarettes have not yet been shown to improve your chances of quitting smoking. However, whether e-cigarettes directly increase your risk of getting lung cancer has not yet been proven. Next, we'll take a look at the risk factors that you cannot change. Firstly, previous radiation therapy to the lungs. People who have had radiation therapy to the chest for other cancers are at higher risk for lung cancer, particularly if they smoke. Now, example includes people who have been treated for Hodgkin lymphoma or women who were treated with chest radiation for breast cancer. Next, we have air pollution. In cities, air pollution, such as from diesel exhaust, appears to raise the risk of lung cancer slightly. Now, the last factor is personal or family history of lung cancer. If you have had lung cancer, you have a higher risk of developing another lung cancer. Brothers, sisters, and children of people who have had lung cancer may have a slightly higher risk of lung cancer themselves, especially if the relative was diagnosed at a younger age.
Now I'll be explaining about the symptoms of lung cancer. Lung cancer typically doesn't show any symptom early on. Noticeable signs usually show only when the disease has advanced. Also, the disease can show symptoms that is vary from a person to another person. Firstly, the most common symptom is persistent coughing. Patient may experience cough that doesn't go away or seem to be getting worse over time. It is also a serious concern if a person starts coughing up blood, even in small amounts of it. Another symptom is shortness of breath. If you notice your breath is becoming shallow even after a small normal activities, it is worth to take notice of your current health. Next symptom is pain in the chest, back, or your shoulder. This discomfort may worsen with deep breath, coughing, or even laughing. If this type of pain persists over time, this may be a sign that the cancer is spreading throughout your body and nearby tissues. Lastly, unexplainable weight loss leading to fatigue or feeling weak all the time are also signs that something might be wrong. Now, it is important to note that these symptoms are also common associated with any other diseases. If you have some of these symptoms, you have to talk to your doctor who can help find the causes.
As you all know, there are currently no cure for cancer. But with the advancement in the medical field, it is very much possible to treat cancer patients. especially when the cancer was detected in its early stages. Here are some of the suitable treatments for lung cancer. The first one is surgery. A lung cancer surgery is done to remove the entire tumor and a part of the healthy tissues to prevent the spread of cancer cells. There are 3 types of surgery for lung cancer. The first one, lobectomy, which is where a part of the lung is removed. The second one, pneumonectomy, where a total lung removal is performed. And the third one is segmentectomy, where a small piece of the lung is removed and is typically done in the early stages of lung cancer. The second one is chemotherapy. Chemotherapy is a type of cancer treatment that employs a potent cancer-killing medication to reduce the rate of spread of cancer. This can be given either before or after surgery was done, and it can shrink down the tumor and destroy the remaining cancer cells. The third treatment for lung cancer is radiotherapy. Radiotherapy or radiation therapy utilizes a high-energy radiation to shrink down the tumor and destroy cancer cells. Here are some variations of this treatment. Number 1 is 3-dimensional conformal radiation therapy, which uses a radiation beam that mimics the shape of tumor, and its targeting information is used to focus precisely on the tumor, thereby avoiding the healthy tissue surrounding it. The second one is the image-guided radiotherapy, which uses frequent imaging during radiotherapy to improve the precision and accuracy of radiation delivery. The fourth and last lung cancer treatment in this list are immunotherapy. Immunotherapy is when a group of medications are used to stimulate the immune system to target and destroy cancer cells. It's given through patients via their arms or body, and they might need to take it fortnightly or monthly.
So, we know that lung cancer is one of the most common and deadliest forms of cancer worldwide. While advancements in treatments have improved outcomes for some patients, prevention remains the most effective way to reduce the burden of this disease. The most effective way to prevent lung cancer is to avoid tobacco in all forms. Smoking is the primary cause of lung cancer, so never start or quit if you currently smoke is crucial. Resources like counseling and nicotine replacement therapies can help individuals quit. Additionally, avoiding secondhand smoke is important for everyone, as it also increases the risk of lung cancer. Radon gas, which can accumulate in homes, is another significant risk factor. Testing your home for radon levels and taking steps to reduce exposure, such as sealing cracks or improving ventilation, can lower your risks. Next, certain jobs expose smokers to harmful substances like asbestos and diesel air pulse, which can lead to lung cancer. It is essential for workers in high-risk industries to follow safety protocols and use protective equipment to minimize exposure. Other than that, eating a balanced diet rich in fruits and vegetables may help protect against lung cancer. Regular physical activity also promotes overall health and may reduce cancer risks. However, smokers should avoid high-dose beta-carotene supplements as they can increase lung cancer risks. Lastly, for those at high risks like long-term smokers, screening with low-dose computed tomography (LDCT) scans can detect lung cancer early when the treatment is more effective. Consulting a healthcare provider about screening options is advisable.